Welcome to the program. The Rudd government's promise of a root and branch reform of the nation's health system is finally starting to take shape. The country's first 2 super GP clinics have now opened their doors, and by next year, nurse practitioners will be recognised under Medicare to treat patients in their own right. It's the first small step in some profound changes to the way primary health care will be delivered in Australia, with doctors working alongside nurses in a team medicine approach that will ultimately impact significantly on the old-style family GP practice as we know it. Deborah Cornwall reports.
My name's Leah. I'm the nurse practitioner on duty today. Come through.
Deep breath. I reckon you have a bacterial tonsillitis.
What I might do is give you some antibiotics. That'll help knock that infection off. Lovely. Okay. Not any
It's the shape of things to come in 21st century healthcare.
Lovely. And then
Nurses, so long the Cinderellas of the health profession, taking over much of the workload of the family doctor.
One of the problems that we have had here in Australia is that we very much kept to that sort of doctor's handmaiden model. We see this as bringing Australia up to speed with the rest of the developed world.
For decades, the pulse of the nation's health has been measured by the state of our overburdened hospitals. But with hospitals now at a tipping point, it's nurses, along with general practitioners, who are about to be called upon to play a starring role in the Rudd government's long-promised health revolution.
I'm not here to say that hospitals aren't important, but primary care has a real opportunity here. GPs, nurses, allied health, working together to keep people out of hospital.
Approximately 300,000 to 400,000 admissions to public hospitals every year in Australia could have been avoided if there'd been an effective community intervention in the 3 weeks prior to the patient coming to the emergency department.
And you're seeing the doctor on Wednesday, aren't you?
At the heart of the Rudd government reforms is a push to follow the lead of most other OECD countries, moving away from smaller family GP practices to much larger so-called super clinics that work on a team medicine approach. Patients will still be able to see their GP when they need to, but nurses will play a far more central role, backed up by a raft of professionals such as dietitians, podiatrists, even personal trainers, all under the one roof.
yeah, does it? Yeah.
This sort of shared care system could in fact end up being a major boon for GPs, who compared to their specialist colleagues have been largely ignored and underpaid for decades. But the idea of sharing equal billing with nurses is deeply confronting for some doctors, who fear the family GP could end up being sidelined by the reforms, leading to fragmented second-rate care.
You can't take for granted the continuity of care provided by generations of doctors. It's going to be automatically reproduced within a multidisciplinary system unless it's very well designed.
Nurses are already widely employed in general practice, but it's the emergence of a whole new breed of specialist nurses, the highly trained nurse practitioner, that's proving a major sticking point.
With my daughter.
If we say that nurses and doctors have to work together in mutually respectful ways, we have to sit down and work out what that actually means. And that hasn't happened yet.
The vast majority of doctors would see nurses as an absolutely essential part of general practice and primary care in 2009. What there is some disquiet about, however, is expanding the role of nurses and indeed of working with nurse practitioners. We want to see people working in an integrated way as part of a team.
Until now, the country's 370 nurse practitioners have been largely confined to major teaching hospitals. But their numbers are expected to grow dramatically following new legislation that will allow them to bill Medicare directly for their services and order prescriptions under the Pharmaceutical Benefits Scheme.
And out.
The move will give nurse practitioners unprecedented autonomy from doctors and place nurses at the heart of family medicine.
This is not in any way to diminish the role of the GP. It's to strengthen the GP's capacity. And the problem at the moment is that the government hasn't enunciated a clear vision for the role of these nurses in these new models of healthcare. We don't want nurses out there being mini doctors.
So you had cancer or
breast cancer, had the lymph nodes taken.
Okay, how long ago was that? Just
The revived chain of medical clinics in Perth are the first in the country to be run solely by nurse practitioners. On offer are treatments for minor illnesses, vaccinations and health checks.
A lot of my patients ring up and they say, look, I've called my GP but I can't get in for 3 days. And so they have the choice. We're not out here pretending to be doctors or whatever. We're the step in between so patients can access their health care.
Despite a non-refundable fee of $65 a visit, the clinics have already proved so popular there are now plans to expand into shopping centres and pharmacies across the country.
The amount of time the nurses spend here is incomparable to what the doctors spend. Doctors just have a lot on their plate. It's a shame that they don't see this as an opportunity to help them rather than a threat to them.
It may not fit the team medicine model, but it does flag the fact patients are open to the idea of being treated by nurses.
I don't believe there's anything to be feared. I believe there is everything to be gained from this. We have a public out there who is not being well served by a health service that does not enable nurses and nurses who are highly skilled to actually perform to the best of their ability.
The doctor is technically qualified to make them feel better.
For those who may get misty-eyed for the days of the old-style family doctor, even the AMA concedes standing still is no longer an option. Younger doctors are simply not prepared to put in the hours of their older colleagues, and fewer doctors than ever are going into general practice.
I'm not surprised that health professionals, of course, have some apprehension when you're talking about some of the biggest changes to our health system since the introduction of Medicare 25 years ago.
The Rudd government has already launched a major charm offensive, consulting doctors and nurses across the country. But while few would argue the need for reform, it may be some time before it can win the hearts and minds of those who'll have to deliver it.
We don't want people, the community or health professionals to be scared of these changes, and there's always going to have to be a coalition of the willing.
I think it has increased the anxiety of a lot of my members who fail to see the direction that the government's definitely going in. It leaves too many unanswered questions.
That report from Deborah, Cornwall.